Here we have a radiographic image. And so one thing I'll be able to tell you sort of right away is that we're looking at a CAT scan, and we're looking at what we call an axial slice, right? So an axial slice is if I'm cutting directly across my body. And so here, what we can see is, and again, I'm going to try and do my best of not using the fancy radiology language and just keeping it simple, just like Michael said. And so big things here, we see a lot of spots. And what I'm looking at organ-wise is the liver. So the first thing you should always try to do is anchor yourself in something that you know. So here, what I'm looking at, I see this big structure on the right side of the body, sort of, it looks like the normal contour of the liver. It looks a little bit enlarged. Then also I can see bottom right, I see another smooth organ in the left lower or left upper quadrant, most likely the spleen. And then in between those two, you can sort of see the stomach. So again, just big, broad strokes. And honestly, even if you don't see the stomach, even if you don't see the spleen, doesn't matter. You see the big liver. And so you see these spots, I'll call them, very irregular. They don't have clear borders. Some of them are rounder. Some of them are more lobulated, as we say, almost like flowery appearing with the little outpouchings. And they're scattered sort of diffusely. And as many of you are already seeing correctly, whenever you see multiple irregular spots in a liver, that should, in the USMLE, automatically trigger you to think of metastatic disease. If you see multiple liver lesions, irregular, always go to metastases. And so metastases to the liver can be due to a number of causes. So the most common cause of liver mets is colon cancer. And so there are a number of other ones. This is one of those, first aid mnemonic. So cancer sometimes penetrates benign liver. Number one should always be colon. Colon is number one that you should think about. And then stomach, pancreas, breast, lung are far less common, but definitely important to think about. But again, this is not a primary liver malignancy, and that's the key. If you see HCC, it will normally come as a single lesion within a cirrhotic liver most commonly. And one person has very astutely pointed out that this liver has sort of irregular borders. The liver contour should be really smooth, but this liver, you can see a little bit of a bump up sort of in the anterior, at the top of the image. And so that would suggest a cirrhotic liver. But again, multiple lesions, even if it is a cirrhotic liver, always think about mets. So that should be sort of your thought process whenever you look at the liver.
It's perfect. I'm learning so much today.
And then, oh yes, so then the other thing that I think is really important when you are looking at some of these radiologic images is sometimes someone will show you an abnormal picture and you're like, okay, I believe you that that's abnormal, without really knowing what a normal liver should look like. So here we've juxtaposed that image that we had earlier with a normal liver. So you can see a very smooth contour. You don't see that sort of scalloping that I was talking about, and you don't see any of these lesions. You don't have any of these sort of scattered spots. So this is a slightly more obvious example, but as we go through and as you're studying, I would really urge you, anytime someone shows you an abnormal picture, pull up a normal one on Google just to have an idea of what it should look like.